Okay, today we're going to talk about the alterations in the nervous system and some of the disorders that happen with the brain and the spinal cord, as well as some of the peripheral nerves. I've combined the portions of chapters 14, 15, and 16 all together in one lecture. I'm going to divide these all into obviously smaller lectures so that you can listen to just the pieces that you want to listen to. This lecture is going to be disorders of the brain and traumatic brain injury. This is kind of any kind of insult to the brain that can produce any kind of physical or intellectual, emotional, any kind of change in the function of the brain. Traumatic brain injury can be either open, where you have a penetrating wound where you can actually see the brain tissue and the dura mater is breached. We can also have closed brain injury. This is a type of injury that happens when the skull and the brain, or excuse me, the skull and the dura mater remain intact, but they can still have some severe consequences. A severe injury to the brain, maybe slamming your head up against a windshield if you've been in a car accident, or maybe a mild concussion in playing some kind of a sport. These injuries can also be what we call focal, meaning the injury is from direct mechanical force, like the head against striking a windshield, or head-to-head combat contact in a football game or something like that. Usually the brain damage is visible to the naked eye. You can see that there is some kind of damage to the brain tissue. Diffuse damage occurs over more of a wide spread. This is going to be injury that occurs in the brain when you have something of impact that causes a widespread damage to the brain tissue. We can have congenital versus traumatic brain injury. Congenital brain injury is injury to the brain and the cranial contents before birth. We'll talk about some of these later on in the lecture. Some of these can be very disturbing and are very difficult to look at. So when we get to that content, I will warn you there are some pretty significant pictures that may be a bit hard to look at. Traumatic brain injury is injury that's caused by some external force, whether it's intentional or unintentional. Any kind of force that comes up onto the head and causes damage to the brain is going to be considered traumatic brain injury. Focal brain injury generally is what we call grossly observable brain lesions. When I say something is grossly observable, it means that I can see it. This is usually some kind of spot or bloody condition on the surface of the brain, and we can see those. Injury is generally produced when you have some kind of contusion to the cranial vault or the vessels that are supporting the structures. Those vessels get broken and they begin to bleed onto the brain tissue. This can lead to irritation of the brain tissue, which can lead to some of the symptomology then that you'll see with these focal brain injuries. Focal brain injury can lead to hemorrhages, again, in the skull and in the brain itself. Some of the hematomas or the hemorrhages that we'll see in the focal brain injuries, one of them is called an extradural hematoma. This extradural hematoma is outside the dura mater, meaning that it's bleeding between the dura and the skull. These can be epidural hematomas and epidural hemorrhages, and they're going to occur generally between the skull cap and the dura mater. They can put pressure on the brain, and this can lead then to some of the symptoms that you'll see with an extradural hematoma. The temporal fossa, the area generally at the temporal area of the brain, is the most common site of the extradural hematoma, this kind of area right along in here. Most people with these extradural hematomas will experience some kind of loss of consciousness. Most of the time, it's just for a very few minutes. Other times, it can actually last for days. The longer that this loss of consciousness lasts, the more severe the type of contusion and potential severity of damage to the brain. General symptoms, again, are going to be determined a lot by how severe the contusion to the brain is. First, headache with increasing severity, more blood gets put into there. The more pressure you get put on the brain, the more the head is going to ache. Sometimes vomiting will come, as well as drowsiness and confusion. Part of the reason that you have this, again, is all of that extra pressure that gets put on the brain is going to trigger a lot of these symptoms. Treatment and diagnosis. CT scan or an MRI are usually needed for diagnosis so that you can observe those lesions on the brain. Prognosis is good if you get treatment early. The longer you wait, the more probability that the prognosis will decline as the health of the patient declines. Subdural hematomas are going to be bleeding between the dura mater and the brain. So you have the dura mater and the brain, where you're going to have what are called either acute hematomas or chronic hematomas, and they're going to occur in the dural space between the dura mater and the brain. These are usually located on the top of the skull. Sometimes when people go forward and hit their head at the top of their head, this is where those are going to occur. Most of these are acute and are going to develop over 48 hours or so. Some of them if the bleed is small, it may take a longer period of time. Chronic hematomas will develop over weeks to months. And again, these tend to be small bleeds that will allow for increased cranial contents to be compressed with either blood or cerebral spinal fluid. The symptoms and treatment for subdural hematoma. An acute subdural hematoma usually is going to begin with some kind of a headache, drowsiness, agitation. Lots of times there'll be a bit of confusion, as well as not being very with it, slow with answering questions, maybe not quite understanding what you're talking about. Symptoms can worsen over time and can lapse into unconsciousness if treatment isn't sought quickly. Respiratory patterns will change, pupillary dilation will occur, and this is an indication that the subdural hematoma is increasing and treatment needs to be forthcoming. Increasing intracranial pressure will sometimes compress the bleeding veins, and this will cause the veins then to become self-limiting. The fluid will dissipate and will actually resolve on their own. Again, care needs to be taken to make sure that you are getting treatment when treatment is required. Chronic symptoms, the hematoma is going to be very slow, and this is going to show chronic headaches, a lot of times tenderness over the area of the hematoma, like kind of a feeling of a bruise. Most patients will have kind of a progressive state of dementia, which will lead into something called peritonia. Peritonia is a generalized rigidness. This can actually lead to complete unconsciousness and death. Chronic subdural hematomas may require some kind of craniotomy or surgical evacuation of the blood between the dura mater and the brain. Intracerebral hematomas, these are bleeding inside the brain itself. These are going to be located generally in the frontal and temporal lobes. These are going to be the lobes of the brain that receive impact most often. They are going to occur generally in the white matter, generally deep in the white matter of the brain. This blood is going to continue to expand and put pressure on the brain. It's going to compress the brain tissue. That's going to lead to some cerebral edema. This can cause a decreasing level of consciousness, whereas some patients will actually end up in a coma. A lot of times people with these intracerebral hematomas will be in a state of confusion, and it will cause them actually to have other injuries that will lead to more irritation of this intracerebral hematoma. Diagnosis is going to be a CT scanner and MRI. You can also do what's called a cerebral angiography to confirm the bleeding vessels inside the brain. Treatment is going to be reducing intracranial pressure, allowing the hematoma to absorb slowly. A lot of times evacuation of that hematoma is beneficial on occasional cases, but usually if you can reduce the intracranial pressure by opening a way for that pressure to move, the hematoma will absorb on its own. Okay, that's the end of this recording on brain injury. And again, as always, send me your questions and I'll get them answered as quickly as I can.